The South African Depression and Anxiety Group, SADAG, has launched a new free online mental health support group for people serving communities. Now, the support group will offer a safe, confidential space for people who serve the community to connect with others who understand and receive support. So to talk to us more about this initiative, we're joined now by Krystle Kemp, who's project manager at SADAG. Krystle, thanks so much for your time. Welcome to Morning Live.
Thank you so much for having me.
So this new free online mental health support group, exactly what is its aim and how will it work?
So SADAG has over 180 free support groups around the country. But Leah's group, which has just recently launched, is specifically aimed at caregivers within communities, those who are trying to do the work to support communities. We know we don't have enough resources. They're facing very challenging situations. And to make sure that we're prioritizing the health care of the caregiver, this group is a phenomenal place for anyone working in communities that feels like it's taking its toll.
So just in terms of what you've been able to glean so far, Krystle, what are some of the challenges and the pressures that people serving communities have to contend with?
So hearing a lot of accounts of trauma, not enough resources, seeing people who may be hungry, people who not be maybe facing unemployment. You know, there are so many challenges within our communities that affect mental health. But obviously, as a caregiver, someone who's giving and reaching out and trying to support, it can be very, very challenging to kind of bear that on one's shoulders. And so this group is for a space where where other community leaders can say, okay, this is what we're facing, this is what we're struggling. It's very real and it's normal that it's also affecting us.
So just in terms of that support, is there, a set number of people who would make up any particular support group, or how will it work?
So support groups typically have between 8 to 12 members, and they typically run for about an hour and a half. So as soon as we go over that, not everyone has an equal opportunity to talk, in which case we would typically split the support group to create more resources. We know a lot of people sign up and then life happens, they're not able to necessarily attend. And so we'll often have groups that have 30 members in it, but those members aren't necessarily coming to every single meeting, but they can join, stay and leave as they feel necessary.
And, in the introduction, I was saying, Krystle, that sometimes these people who work in communities see the most gruesome things, and that may be hard to contend with, from burned bodies to, as you mentioned, perhaps children or elderly people who are malnourished, not taken care of. And in terms of their mental health, how does all of this impact on them, and how does it impact their ability to perform their duties properly?
So I think it's key to prioritize the mental health of caregivers. So SADAG doesn't only offer support groups. We also have over 30 toll-free helplines, including the country's only suicide crisis helpline. So any community leader feeling exhausted, feeling as though their mental health has taken a knock, we really encourage them to phone SADAG. We're open 24 hours a day, 7 days a week. It's totally toll-free, so that a counsellor can assist them. We need to prioritize everyone's healthcare because we know we can't pour from empty cups. And so, especially in the case of community leaders and stakeholders, we need to ensure that they also know where they can turn to for support, um, and make sure that they're also getting the help that they need.
And in this group, Krystle, would police officers, for example, is this something that they can join?
Absolutely. Any community stakeholders, police, religious leaders, social workers, doctors, really anyone who's actively trying to make a difference in communities is absolutely welcome to join.
And from across the country, so it doesn't matter where you are, you will be paired with like people.
Yes, absolutely. So SADAG's groups, some of them are online, some of them are face-to-face. This group in particular, run by Leah, is online, and so anyone from anywhere in the country is welcome to join and connect with others who really have a first-hand understanding of some of the challenges they're facing.
And for those watching right now, Krystle, how exactly do they get in touch, in order to join one of these groups?
So you can definitely reach out to our SADAG website, www.sadag.org. It is an incredible resource of materials, webinars. You can see all of our 180 support groups for a variety of different topics. There's basically a group for everyone. Or you can phone us on 0800 456 789.
And just before I let you go, with the scourge of drugs in our communities, I mean, here as well, that there's so much that community workers need to contend with, and what they face, whether it is from the actual drug addict or family members who may be victims or members of the community. Are those some of the things that the group will also look into?
So we have dedicated groups for those using substances or those facing addiction, as well as caregivers, family members, and loved ones of those who have substance use problems. And so absolutely, there's so many different groups that really there's something for everyone. But we know substance use is a major issue. And we also even have a dedicated substance use helpline with the Department of Social Development.
So there you have it. And Krystle, thank you so much for speaking to us. Krystle Kemp, project manager at SADAG, and talking to us there about this new online support group for people that serve our communities. And if you're one of those people, one of those caregivers, or any of the other stakeholders working in any of our South African communities, we know that sometimes you are faced with very tough situations, things that may affect you mentally or may be hard to get over. So SADAG has established this group, and feel free to contact them so that you can become part of a group that would help you debrief and deal with the mental health aspects of this. All right.